a lot of the other issues that you do need to look at as your practices become more integrated and you go from practicing in a solo or a small group practice. Many of these other issues may be things that you haven't really thought about in your practice, but they're things that you really do need to think about. And as Alan said, kind of like the antitrust, these things are things you don't want to have to try to do on your own. You need to seek out counsel who understand these healthcare issues, because violation of them in some cases can lead to a lot of fines, and in some cases are criminal violations. And so when you get into that realm, you really want to make sure you're doing it the right way. So as I mentioned, as you become more involved and become more engaged and integrated with other professions, you definitely want to make sure that you're looking at all of the laws, the whole spectrum of the issues that are involved in your practice. And so what I want to cover today in about 15 or 20 minutes is the fee splitting laws, anti-kickback, the self-referral law, often known as the Stark Law, corporate practice of medicine, some of the state laws, and then fraud and abuse issues which you're going to see. Okay, the first one is the fee splitting law. And as many of you may know, that it's inappropriate to give or accept fees or other type of compensation for somebody referring a patient to you. You may think that, of course, that's obvious. Cliff and I, Cliff Barnes, who is one of my partners at Epstein, Becker and Green, we still see on a daily basis lawsuits and settlements of providers who have paid for patients. It's unbelievable that despite these laws, there are people who are paying for referrals. So although you think that it's obvious, there are still people who do it. And it's not just paying money, it could be some other type of compensation or remuneration. So, gift cards or paying for things for somebody. Those can all be considered to be some type of a referral to get a patient into you. Many of the states have laws that prohibit referral fees. It's also a violation of the APA Code of Conduct, the Ethics Code, and there was a practice update back in 2014 that addressed it. The anti-kickback statute is another major statute that prohibits the offering, paying, or soliciting or receiving of any kickbacks or other compensation for healthcare services that are reimbursed by a federal healthcare program. The federal healthcare programs would be Medicare, Medicaid, TRICARE. Those are the three most important ones. And I think, as Catherine said in her keynote, the majority, or about 40–50% of mental health services are paid for by Medicaid programs. And so it's very important that you understand the anti-kickback statute. And as Medicare is trying to roll out more programs for behavioral health services, you may come under this law in ways that you had not before. It includes, as part of the offering or paying or soliciting, receiving, any type of inducing purchases, leases, orders, arranging for any good or service or item paid for by a federal healthcare program. Compensation includes bribes and rebates. Again, the bribes and rebates may seem obvious. What the regulations actually include are very detailed. It can be actually free services. free programs, tickets to things. It could be, it gets down to, the offering of handouts or free T-shirts. I mean, there are some minimal things, some de minimis things that you can do which are not considered to be compensation, but they are very de minimis. I mean, we're talking like maybe a pencil. I mean it. It's surprising how little you can do. I mean, people talk about giveaways and promotions. Managed care companies are very controlled in the types of things that they can do for enrollees. And so you just need to be very careful in terms of giveaways. Also under the anti-kickback statute, waiver of co-pays and deductibles are another thing that Medicare and Medicaid look very closely at, so that if the patient comes in and they have a $10 copay, a $2 copay, whatever it is, if you routinely waive that, the Medicare and Medicaid programs look at that as an inducement and a possible violation of the anti-kickback statute. That doesn't mean that you can't waive them on an individual basis based upon financial need or hardship, but those have to be on a case-by-case basis. You can't advertise it. I mean, it used to be years ago people would advertise, we'll waive, we'll accept insurance only, and we'll waive whatever the copay is. You can't do that. That's a violation of the anti-kickback statute. So again, there's the obvious, a bribe, okay, that's fine. But it's these little things that can get most people into trouble and where the enforcement really is and can lead to some significant repayments.
Kevin, before you move on, could you just give a simple example of how giving away a T-shirt could be inappropriately a violation of this? Who would you be giving it to, and what are you trying to do? I think that.
Well, I mean, a lot of times you see things at health fairs. You see things at where patients will come in and if they do certain things, if they come to their visits, you will give them X, Y, or Z. Like if they make 4 appointments in a row, you'll give them a $50 gift card or something. It's always well intentioned, or it's frequently well intentioned that it's tried to induce cooperation and participation, and you may have the best interest of the patient at heart, but or it could be that you're giving them away to your referral sources, so that the primary care doctor who's referring patients to you, and I've seen this just recently, where a physician had given gift cards at the holidays to the top 100 referral sources because that person had sent them, X number of patients, and it wasn't that they were trying to induce more. It was kind of a thank you. It was a holiday. It was, a $50 or $100 gift card to a local service, but it was clearly a violation of the anti-kickback statute because those were referral sources. And so those are the types of things that you want to stay away from, but you frequently don't think about. And we'll have questions in a few minutes, unless it's something specifically related. Lunches? Lunch and learns. There frequently people provide lunch and learns, and even AmeriHealth was talking about the fact that they go in for lunch and learns. Lunch and learns, you can, there is a dollar amount total that you can do for practices, by physician, by provider, and then particularly with lunch and learns, there's a regulation on that you divide it by the number of people who are going to participate in the lunch, and so depending upon the number of those people, you can fall under the threshold of the per person allowance. So once or twice a year going in for a lunch and learn, it's okay. Doing it every week, and dropping off food and some very expensive things or tickets and things like that, you can't do that. And again, these rules, the Medicare rules, the Medicaid rules, are some of the most complex, convoluted rules that you will ever find, and trying to find the simple answer sometimes is not the easiest thing. That's why why Cliff and I get hired by companies to provide these answers is because there are very, very specific rules, and it may depend that the answers may not even be the same for Part A of Medicare or Part B of Medicare, Part D of Medicare, Part C of Medicare, or the Medicaid rules. And so they're all very, very different answers. And so a simple question may have, multiple answers depending upon the provider that we're talking about. The Stark Law is also known as the Physician Self-Referral Law. And it states that if a physician or his immediate family has a financial relationship with an entity, the physician can't make a referral to the entity for designated health services covered by Medicare. And immediate family can include a broad spectrum of people. It's not just husband or wife, or it includes parents and children and grandchildren, and there's a whole, the definitions is, as Jana said in her speech about contracts, and it's also true of regulations, the definition of a certain term is key to understanding whether you're in compliance or not. But the designated health services, there's these are all of the designated health services. So if you're making a referral for one of these things and it's a physician, there could be, and there's a financial relationship, there could be a problem unless, of course, you fit into one of the designated exceptions that are clearly spelled out in the regulations. Now, a lot of people here will say, okay, but I mean, we're psychologists. I mean, for the most part, Stark doesn't really apply to psychologists, which is true, but it would apply to a psychiatrist. So, I mean, the psychiatrist is obviously a physician, and so it could apply to physicians who refer to the psychologist. If you've got a group practice where psychiatrists are involved, obviously the Stark Law would be applicable. Or if the psychiatrist is making referrals to the behavioral health practice where the psychologist is practicing. It is a much narrower scope than the anti-kickback statute, but it's a very complex law that physician referral sources definitely need to understand. Now, here are some of the differences between the Stark Law and the anti-kickback, because it seems like in some ways they could cover the same topics. The Stark Law is governed by Centers for Medicare and Medicaid Services, where the anti-kickback statute is regulated by the Office of Inspector General. The Stark Law prohibits referrals where a financial relationship exists, and the anti-kickback statute prohibits payments intended to induce referrals. Stark Law has civil penalties. The anti-kickback statute has criminal and civil penalties. Again, the OIG has started more and more enforcement where they're trying to enforce more of the criminal penalties and not just the civil penalties. The anti-kickback statute is an intent-based statute. So they look at, what was the intention. It's for more, the analysis is, what did you intend to do when you set out to do this. The Stark Law is a strict liability statute, meaning you're either in compliance or you're not in compliance. I mean, there's no gray area like there is in the anti-kickback statute. The Stark Law applies to physicians. Anti-kickback statute can apply to anybody. It can apply to people who aren't even licensed. There are mandatory exceptions under the Stark Law. The anti-kickback statute has safe harbors. We'll move on now to the corporate practice of medicine. And there was a reference to this earlier today that the corporate practice of medicine is state law that prohibits a general corporation from applying psychologists. The corporate practice of medicine is actually kind of a strange name because there are a lot of corporate prohibitions on general corporations employing licensed professionals. So there's dentistry, optometry, veterinary. And they're not always the same even in the same state. So there are states that prohibit corporations from employing physicians or psychologists that may allow it for nurse practitioners to be employed by a general business corporation. There are states that allow medicine or physicians to be employed by general business corporations, but not an optometrist. So when somebody tells you, oh, I know that XYZ state is a corporate practice state and professionals aren't allowed, again, make sure you have it checked out first, because I've been doing corporate practice work now for several years and spend a lot of my time doing it. And it's shocking the difference in states, and sometimes the state themselves, if you talk to the different departments of health or board of nursing or board of medicine or the behavioral health area, you'll find out that they don't even know what the other department, how they enforce it. Okay. Corporate practice, it frequently will require a licensed professional to own the professional corporation. We'll talk about that after lunch. It may not allow the business to be owned by any lay people or not be allowed by a general business corporation. There may be certain exceptions in states for ownership by hospitals, HMOs, and in some states there actually are exceptions for ownership by lay or business corporations as long as it's under a majority. It doesn't just go to ownership. The corporate practice regulations also apply to how the decision making is made within a professional corporation. So in almost all of these states, a professional has the ultimate decision making authority. It can't be influenced by outsiders, even a management company, and we'll talk about that this afternoon with the management services organization. Some of these things are, the determination as to how many patients a provider can see in a given period of time, the tests that are appropriate. Advertising, as Jana said just a few minutes ago, that ultimately has to be decided by the provider, and in many states, the rates that are charged and contracting with payers has to ultimately be signed off by a provider, not a management company. In terms of state law, there's a lot of mini False Claims Act. There are state anti-kickback laws. There are self-referral laws, fee-splitting laws. All of these things, in addition to all the federal ones that I just talked about and the corporate practice ones, you'd also want to talk to an attorney who understands health law to understand these types of laws and do they apply to you. In terms of fraud and abuse, you've got, there are various enforcers. They have different tools, and in terms of issue spotting, it's kind of this smell test. If it doesn't sound right and you're worried that maybe this could be a violation, it's probably a violation, and you should have somebody be looking at this. Because if you don't have it looked at, that's when you can run into trouble. So who are the fraud busters? You've got the Department of Justice, both the U.S. attorneys and the FBI, the Department of Health and Human Services. There are other federal and state agencies like the Medicaid fraud departments. Medicare, or the Railroad Board actually has its own enforcement agency. There are private third-party payers, and under the key TAM lawsuits, you actually can have private citizens, customers, or former employees who can also raise this. And it's actually interesting because one of the most common sources of key TAM suits are people who used to work for you who somehow have left and not always under good terms, and they frequently will go to the government with and raise the issue of somebody violating one of these statutes. There are a lot of laws that fight healthcare fraud, including the False Claims Act, the self-referral law, as I mentioned, the Antikickback law, and then there are other things like the Social Security Act, the Criminal Code. HIPAA in particular also has fraud provisions, and then there are state laws. The False Claims Act, right now, if you, what would be a false claim? So if you upcode or unbundle could be a false claim. If you receive an overpayment and don't repay it back within the time period that's now required by law, particularly for Medicare, that's considered a false claim. So all of these things can have significant financial consequences, because the penalties are, I believe it's is it $10,000, $11,000 per claim now, that they can get for a false claim. So, I mean, when you start to think about the number of claims that a provider goes through in the course of a practice, if you're doing it wrong consistently, the penalties and fines can be significant. So that's it.